Okay, good morning everyone. So I don't really know if we're gonna have time to video before my actual appointment today. So I wanted to go ahead and do this little video, and I know, yes, I am driving, so please do not follow in my footsteps. But I am heading to Amanda Lessmith's office right now for a liner appointment, and I'm super excited, but I'm also really nervous because I don't know what to expect. So I've done the lips with her, I've done the brows. As you can see, I don't have anything on my eyes. I actually had to stop using my Grand Lash Serum, so I've been slowly watching my eyelashes shrink to nothing. So basically I had to do that to kind of prep for the liner procedure, because apparently with that serum it actually brings the blood vessels kind of to the surface of your skin, so where your eyes are. I don't know why I did that, so obviously you know where your eyes are. So it brings the blood vessels up to the top, and it kind of creates more of a risk for hitting those vessels. So obviously we do not want that to happen. So for the past month and a half, I have not been using any of the serum. So my eyelashes are basically back to normal, unfortunately. And then you can also see that my brows are still healing from the previous appointment. It's only been about a week since I got the powder brow done, and I'm absolutely loving them. So yeah, just wanted to give you a little intro to the liner appointment, and so you can see my before.
Okay guys, we are getting ready to do permanent eyeliner on Christina here. And as you can see, her brows are actually still healing. We're about a week post brow procedure, so she is knee deep in the flaking stage, so it's not the prettiest right now, but it's just part of the process. But today we're going to do a top eyeliner, so just the top lid. You can do both the top and bottom if you want to, but Christina wants to do the top, and a lot of people do just the top, but you know, you're able to do the bottom as well if you like that, if you wear that. I always tell people, you want to do a look that you are comfortable wearing every single day, because this is a permanent tattoo. It will fade over time, but we want something that she's gonna like to have all the time. So we can do something extremely subtle, such as a lash enhancement, or we can do something more dramatic, like an actual eyeliner. And I can make it as thin or as thick as you want, depending on your skin and your eyelids. You know, so certain things will limit us. You know, if you have a vascular eyelid, like me, such as Christina, yeah, she has. What I mean by vascular is there's capillaries that are visible. So when you have visible capillaries on your eyelid, you don't want to make it too thick, because there are risks with it. So I'm a really conservative artist, and I don't like to take risks with people's faces. So we're not going to do super thick. We're going to do, you know, a lash enhancement with a little bit of a liner above it as well. So it will look really pretty, great for day to day, and we'll see how she does. And if her skin performs well, then at her touch-up, we can go even thicker. One of my clients' main concerns usually is, you know, how safe is it? So like I said, I'm really conservative, and I always want my clients to feel secure and safe. So one of the things that I do is I always make sure my client's eye is closed the entire time. And so if they were to even try to open their eye, they wouldn't be able to because of the way that my hands are positioned. So I'm going to show you guys as if I was actually doing it. What I do is I stretch the skin. So I pull her eyelid out a little bit, and then I position my thumb on the top of the eye. So are you comfortable?
Yes.
Okay, I want you to try to open this left eye.
No.
Not possible.
Yeah, I can open the right one.
So when I'm working with the tool here, you know, it's not possible for her to open her eye. So we'll just pretend like with a Q-tip here, stretch, and my hands are positioned, try to open. Not possible.
Right.
Another thing to keep in mind is the needle is extremely small, and it's also it's not going deep at all. It's going like less than a millimeter into the skin. So I know that's kind of hard to visualize, but if you think about like a dime, like the thickness of a dime, it's going even less than that, like maybe a quarter of that. So it's really not going deep at all. The pain level is different for everybody, but generally people say it's usually a 3 out of 10. Depends on if you're on your cycle, that will affect things. It could make you more sensitive. If you just have a low pain tolerance, it could make you, more aware of the pain. But I do numb, and that's actually what we're getting ready to do right now. So first thing I'm going to do, I actually want to show you my tray setup over here. I don't know if you can see the tray over here. I'm gonna let you guys, I'm gonna talk you through it. My tray setup is 100% disposable. So everything on here is just for Christina, and when I'm done, I actually just lift up this garbage bag, which is obviously single use, and then throw everything away. So it's all sterile. My clients, when you're with me, there's not a risk for infection. When you leave, if you're touching your liner, your brows with dirty fingers, obviously there's always a chance for secondary infection, but I try to be really, really clean and sterile. Everything here is wrapped with barriers so that, we have no chance for cross-contamination. So we've got our pigment, our numbing, our primary numbing, our secondary numbing, cottons. I use eye drops. These are Refresh eye drops, so they're great for, just keeping the eye moisturized during the service. So I'm gonna go ahead and put some eye drops in your eye. I'm gonna have you stay closed.
Okay.
And I'm just going to gently open and put a couple little drops in. Here. And I always send my clients home with these too, because if they feel later like their eyes are dry at all, or you have something in your eyes, you can always put some of the eye drops in. They're single use, so they're not, there's no bacteria on them like at home if you used, your eye drops from months ago. You never know what's harbored on that. We've got our single use sterilized needles. So I use 2 different kinds for this procedure so that I can do some detail work with my 1-liner and then saturate more color with my 3 or my 5 round liner. Okay, so I'm gonna get ready to numb now, and we're just gonna have you stay closed. All right, let's get started with our numbing. I'm going to be applying it over the entire lid because I want to give her a really good numb. Okay, so we're gonna let that sit for 25 minutes. I'm gonna let Christina just relax and enjoy her little cat nap, and we will be back. So the secondary numbing is just gonna sit for a couple of minutes, and this really helps to just give her a solid numb. And as the client, if you wanted to, you could always bring your headphones. Like if you wanted to listen to a book on tape, a podcast, your own music. I mean, you could even play it on my speaker. I don't really care. Sometimes people like to wear headphones though, just as long as you are able to hear me to communicate, just in case I need you to like move your head or just to kind of tell you like what's going on. So I'm starting off with blackish brown. It almost looks black, but there is some warmth in it as well. We're gonna get started.
Thanks for watching my what to expect on your liner tattoo procedure. Make sure to hit the like and subscribe. See you next time.